And joining us now, the Surgeon General of the United States, Vice Admiral Dr. Vivek Murthy. Dr. Murthy, good morning. It's good to see you.
Well, it's so good to see you too, Savannah.
Well, before we get into the details of this, I have to say I had a little bit of deja vu because we do remember when the White House rolled out a big plan for booster shots for everybody. And then a few weeks later, the FDA and the CDC said not so fast, and it was much more limited. Are you worried about jumping the gun again this time and leading to more confusion?
Well, Savannah, the bottom line is that we have to be prepared to ensure that we can get vaccines to families as soon as the FDA and the CDC issue their decision. And that preparation takes planning, it takes time. And that's why we've been working very hard to do a few things over the last several weeks to months. Number one, make sure we have enough supply for every child in the 5 through 11 range. Number two, make sure we've got tens of thousands of locations where people can get vaccines, from doctors' offices to pharmacies, to schools, to community health centers. But third, and this part is really important, Savannah, we want to make sure that parents have answers to their questions, that they have accurate scientific information that they can use to make their decision. And we know there's a lot of misinformation out there. So we've been working really hard with doctors and nurses and teachers and parents and other community organizations to make sure people can get answers to their questions from sources they trust.
Is there a threshold, a percentage of children vaccinated that is the point where you feel like, okay, now we're starting to break the back of the pandemic? We will be able to reduce the outbreak if we can get to X percentage of children vaccinated?
Well, it's a really good question, Savannah. And one of the things that we've learned is that that magic number is hard to predict, but we do know that every child vaccinated makes a difference. I say this as a dad myself. I've got 2 kids who are under the age of 12, and so they haven't been eligible to get vaccinated yet. So like many parents around the country, I am so excited for the prospect of a vaccine for kids. This will be an important milestone. But every child who's vaccinated means one fewer child who is susceptible to the risks that we see right now, where so many kids have gotten COVID, thousands have been hospitalized. Sadly, we've lost hundreds of children to COVID. So this is not a benign illness. But also, Savannah, let's remember that COVID has also disrupted our kids' lives. It's made school harder. It's disrupted their ability to see friends and family. It's made youth sports more challenging. By getting our kids vaccinated, we have the prospect of protecting them, but also getting all of those activities back that are so important to our children.
A Kaiser Foundation family poll found that just 34% of parents said they'd vaccinate their children right away. Another third said they would wait and see. 24% would definitely not. We've already seen California institute a statewide vaccine mandate for K through 12. Do you believe that vaccine mandates for schools will be necessary and appropriate?
Well, Savannah, we have to take those numbers in context. If you actually look at the adult vaccination effort, before a vaccine was authorized for adults, the numbers were not that dissimilar. It was under 40% of adults who said that they were ready and willing to get a vaccine right away. But what happens is that once the FDA reviews the data carefully and opines on it, once people start seeing their friends and family get the vaccine and do well, and once they also have a chance to get accurate information, talk to their doctor, hear from credible sources, then people's confidence builds. And we've seen that certainly with adults. We've seen it with adolescents.
Well,
I anticipate that's exactly
the Biden
what we'll see
administration,
with children as well.
Sorry to jump in there, but ultimately the Biden administration did resort to mandates in some situations. So again, I just ask if you think that we will need vaccine mandates in schools if people don't voluntarily get there.
Well, it's a good question, Savannah. Those are decisions on when it comes to school requirements that are made by localities and by states. You've seen already some localities and states talk about vaccine requirements for kids. And I think, look, it's a reasonable thing to consider to get those vaccination rates high. And it's also inconsistent, Savannah, with what we've done for other childhood vaccines like measles, mumps, polio. And what these ultimately do is they help create a safer environment in our schools so our kids can learn and stay safe.
All right, Surgeon General Dr. Vivek Murthy, nice to have you with us this morning. Thank you.
Thanks so much, Savannah. Take care. Good to be with you.
Thanks.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.